Welcome back to WXXV News 25 at noon. I'm Trey Tonnessen, but more importantly, we now have two very special guests joining us. I'll let them do the honors and introduce themselves and their titles.
My name is Kimberly Cruz, and I work with the National Diabetes and Obesity Research Institute. I'm one of the dietitians and the outreach coordinator there.
And I'm Dr. Stephen Farrow with NDORI, the Executive Director and Staff Endocrinologist.
Excellent. What is the overall goal and arching focus of the Institute?
The goal for us is to reach those that are struggling with type 2 diabetes and obesity. We have certain programs lined up specifically to help those in the areas of nutrition counseling, but also we have nurse practitioners on staff to give them the extra need of the endocrinology that they're probably missing with their primary care. So a lot of one-on-one sessions, but also group sessions that we do. And we also have research a part of our facility as well, where we're starting to see new studies come along, again, related to obesity.
Okay, that's also excellent to know that it's right here on the Gulf Coast, but I know you're more so on the historical side and know a lot of the history of the Institute. How long has this been around, and how did it get started? What kind of spurred the original Institute?
Wonderful question. I will give a name drop. Joseph Kenneth Zero, many people are familiar with him. He's a very successful developer and philanthropist in the area. He grew up in Biloxi, and as time went on, he wanted to identify a way to give back. So he worked with the governor, the legislature, leaders in business and industry. Back in 2014, they came together and decided it would be great to have an institute to focus on one of Mississippi's biggest health challenges, diabetes and obesity. So back in 2014, they created the National Diabetes and Obesity Research Institute, which we occupy now. Over the ensuing 6 years, steps were taken to set up the structure of the organization and the services that we offer. So as Kimberly said, our goal is ultimately to educate and prevent diabetes and obesity in the first place. Second, to improve the treatment by helping make sure that our fellow clinicians have the latest information. And then third, discover new drugs and ultimately a cure for diabetes and obesity.
Excellent. A question that I just thought of, this is something that just popped into my mind, and I guess it probably kind of relates, especially the past few years, with the Institute having a great past with helping a lot of people, especially here on the Gulf Coast and other areas. How have the goals and the method of operations changed since the pandemic and just ever-changing diets and lifestyles?
I could start with that.
Yeah.
Back in 2020, because of the pandemic and travel was curtailed, we actually instituted telemedicine. So not only do we offer direct care here on the coast, but we actually offer remote care to areas such as the Mississippi Delta and other areas in Mississippi, which we weren't doing before. It expands our reach tremendously. In addition to that, we actually stood up our own internal clinical trials operation, which is something that we had not done before. In addition to Kimberly's launching the new Diabetes Expo, which is in its second year, we also have a regional summit which actually invites international speakers that we hold every March. And that is going to be entering its third year, and it is accompanied by a research competition for undergraduates who might be interested in diabetes and obesity.
Okay. And running a little low on time, but I quickly want to give either of you the floor. Is there anything that kind of you really want to get out there to most folks here on the Gulf Coast, or even in a wider range?
Yeah, so with our institute, we are having a diabetes awareness and health expo. It's free to the public. It will be at the William Carey University in Tradition area, which is Biloxi. And again, that's where our facility is located as well, but we're next door to the William Carey. So it's going to be free for everyone to come out. We'll have health screenings, we'll have speakers and a cooking demo. So just inviting anybody who feels maybe they're not sure if they have diabetes and want to find out, this would be the place to do it.
That's awesome, and it's great to have you both here. I really appreciate you coming and doing this interview.
Thank you.
It definitely help a lot of people on an everyday basis, and it's great to get you here on the set. So we'll have more information on our website, but next we have Rob in studio with a look at our forecast. But first, here's a look outside at your lunch hour traffic. This is I-10 West at mile marker 53.